Hey, and welcome to the first ever Sequence podcast. I'm your host, Dr. Spencer Nadolsky, and I got one of our awesome clinicians here, Dr. Danielle DonDiego.
Hey
And today
guys.
we're gonna be discussing just obesity management overall on a telemedicine platform, whether it's whether it's right to do it in telemedicine virtually versus in the clinic. I do want to say that both of us, so first of all, Dr. Danielle and we were classmates. She was a year below me at med school, so we know each other pretty well. And both did family medicine and then
Yep.
specialized further into obesity medicine. And both of us have kind of unique. We both were in the clinic and finally got out of the brick and mortar clinic, and were able to get on a virtual platform, which we personally like, but we also think the patients like it more. So welcome, Dr. Danielle.
Hey,
Uh,
thank you.
yeah. So uh, what's your? You went to med school at you went to undergrad at Florida State,
At Florida State, yes.
and then you went to Virginia College of Osteopathic Medicine, which is now Edward Via College of Osteopathic Medicine, Virginia campus. But whatever, we're gonna go with the
It's
OG
a long
name.
name.
And then you went to family medicine residency. So what's your career been like throughout, like when you first got into med school, what you wanted to do, and then now what you're doing?
Yeah, my career progression I think has been fairly similar to yours, but it was I was definitely one of those med students who liked everything. I went in thinking I was going to do something surgical, to be completely honest. I was like obsessed with orthopedics.
Nice.
Which I think, there's a lot of lure there when you first go to med school. I really liked anatomy and whatnot. But yeah, I did my undergrad at Florida State for 4 years and then went to VCOM for medical school. And honestly, just through third year, I got into this place where I started to like everything. And I got really confused, which I don't know if enough medical students or doctors talk about. A lot of people seem like they know exactly what they want to do going into
Yeah.
medical school. But for a lot of us, it's we like a little bit of everything. So family medicine actually made the most sense for me to specialize in. It gave me hands-on experience in almost every field to some extent. And I also have a background as being an athlete and a personal trainer, and I was really into preventative health and helping people to, prevent the things that we so often treat when we're in the hospital. And so obesity medicine caught my attention. I believe it became a field when I was a resident. So it's
Mm-hmm.
a fairly new field of medicine. And I was decided to get my certification after I became board certified in family medicine after residency. And it's honestly been one of the best things I've done because after treating patients as a family medicine doctor through residency and then in private practice and as a hospitalist, this is something that we know needs to be treated and fixed. And often we didn't have a lot of either time or knowledge or resources to give appropriate advice. And so obesity medicine really fell into my hands. And it's so amazing that we have options for people now, like real medicinal options that we can help people, lose the weight that they need and prevent things like diabetes and high blood pressure and all that.
Yeah, back when we were,
Yeah.
so I think you came to the obesity conference. Was it? Uh, it was.
2016. It
Was
was
it?
right after I graduated residency. I like immediately started studying for the obesity boards, and so yeah, 2016. Gosh, it's like
And we met in Nolens. Wasn't it
it was in New
Nolens?
Orleans, and it was Halloween weekend. I remember that
Oh,
because
that
New
was
Orleans
fun.
was on another level.
Yeah. So okay. So you were in the clinic though. So what
Yep.
was it like in the clinic? You talked about kind of those system issues where you don't get as much time. You may have some admin pressure to see people quicker, faster, and not necessarily get the time to do what you wanted to do.
Yeah, I actually discussed this a lot. So I joined a practice right out of residency, and honestly, it was a great experience, but it was your very busy, hospital run practice. I was seeing anywhere from like 25 to 35 patients a day, which is, pretty standard, but it's a lot. And when we're in primary care, we see a little bit of everything. So rarely does somebody come to us with one issue. Typically, they come in with one complaint. Maybe they have a list of 3 or 4. They have a bunch of chronic issues. We have a 15-minute appointment. We're trying to do as much as we can, as efficiently as we can. But when it comes to that preventative lifestyle part of medicine, you need time. And it's easy to just say, oh, you need to lose weight, but like that's not helpful.
Hmm.
It's not helpful to anybody. Most people know if they need to lose weight or that it would help them. It's
Yeah.
kind of like saying, hey, you need to quit smoking. It doesn't really stop there. So my experience those first couple years, man, I got really burned out really fast as a physician. But I felt like I was rushing through patients just to stay on schedule and stay on time. And it was this constant battle of providing good care of what I know the patient needs and trying to, get through the work at the end of the day, which was hard. So I had a hard time adjusting. And this is coming from residency where we were working like 70 to 80-hour
Yeah.
work weeks. So I wasn't immune to long hours, but it was a different animal for sure.
Did you feel equipped in the clinic to help your patients with obesity, or was it kind of just, were you on your own? Like just,
We had a bariatric program, so I often
okay.
would work with the pre and post surgical patients as well, and I had a good relationship with that department. And so I felt from a knowledge and resource perspective, like we had the boxes checked. What I didn't have was the time and the space to really appropriately, from my perspective, counsel patients. So I think we checked all the boxes, but I was essentially in a full blown primary care practice, also trying to do
Right.
obesity medicine. And I learned very quickly that you need to stick with, primary care office is one thing, and obesity medicine is truly another. It's another division. We need the time and space, and we need to focus on that when they come in.
Yeah, that was kind of my experience. I thought I was kind of, I don't know, you might say naive. I was like, I think this should be integrated into primary care, and we should just address it while we're there. But
Hmm.
quickly I realized that was a mistake, and you're right. It needs to be a focus and not just, oh, this person has a cold. Okay, I got to treat them. Okay, this person's coming in for, back pain. Okay, all right. And some people might say, well, their back pain might be related to their weight. Yeah, it might be, but they're coming in for a specific problem, acute problem at this moment. And so it didn't work as well. The flow didn't work as well. So
Yeah.
I agree. So then you were able to get out of the clinic and turn into the virtual world,
Hmm.
right around when I did, working for the same company, but we were still doing primary care at that moment.
Yeah.
What was it like transitioning to virtual care then? Did you feel like it was
Yeah. So when I
good air?
started doing telemedicine, I think I got that call in, I think, 2017. So it was soon after, and I was looking for a change. I actually joined. I was doing locums hospitalist work while I started doing telemedicine. So I've done all of the like checkbox primary care things: urgent care,
Yeah.
hospital, private practice. And so I was like, let's do telemedicine. Let's give it a shot. And this was before, now it's pretty popular. It's certain types of
Yeah.
telemedicine. Since 2020, I feel like it really exploded. But back then, it was really novel, and people were like, is this really a career? Could you really practice
Yeah.
medicine without laying hands on a patient?
Yeah.
And I think I was open to seeing if that were possible. So I took the chance. I was in a good place in my career to do so. And it's a primary care practice. I still see patients from a primary care perspective through telemedicine. And it has its perks, but it has its limitations, as does anything. Inpatient or in-person practice, has its limitations with time and getting appointments and things like that. With telemedicine, I found we have a lot more time, but and we are able to do a lot without necessarily seeing the patient in person. We can gather a lot of data from a patient with talking to them. But we have to also know where our limitations are and know when they
Yeah.
need to see a specialist, when they need to be seen in person. I always say that's key for someone who wants to go into telemedicine. You have to have a good triage mind, and not try to be MacGyver to an extreme. So I found that with primary care, it is difficult online. It's possible for the right patient, and I see it more as an adjunct to having an in-person primary care doctor. So if you have your
Yeah.
in-person doctor who can see you for your regular things, but you use telemedicine for the things that you don't need to be seen in person, or at least get advice on things, it's actually like a perfect, I feel like it could be a perfect combination, but neither alone is efficient.
Primary care, because people have acute issues. We've talked about this before. Respiratory distress. Oh,
Right.
maybe you need to see somebody in person. I can't do your vital signs right there. Sure, you can check your pulse. Maybe you have a decent blood pressure cuff at home. Maybe you have a pulse oximeter checking your oxygen levels. But then I can't listen to your lungs. I can't assess you. I can't
Hmm.
really see whether you're like, do you need to go to the ER or not? So those are tough cases. But what
Yeah.
obesity medicine, chronic care. So I always think of like just the easiest example is like hypothyroidism. Do you really need to see somebody? You don't need to, once you diagnose somebody with hypothyroidism, do you need to see them? No, you check their levels, ask them how they're feeling, and that's
Yeah.
it. You don't need to have them come back to the clinic. And that's what, we see that a lot in primary care. But obesity medicine is another one of these chronic conditions, but there's an added element to it because there's a lot of stigma in healthcare against those with obesity. I wish could say there's not, and I wish I could say all doctors are awesome, but you know, we're obesity trained. We've taken courses in sensitivity, stigma,
Hmm.
biases, and really, unfortunately it's still out there. So you hear about the patients that go into their doctor, and the doctor just says, "You need to stop eating so much, and you need to eat chicken breasts and spinach." And it's like, well, gee, thanks. And like I wish I could say that that's some people are like, no, you're exaggerating, you're lying. I'm like, no, I could hear one of my patients when I was in the clinic go to see another doctor because I was full, and I could hear them through the wall saying that, and I was like, oh my gosh, what's
Yeah.
going on right now? So with now that can be traumatizing, feeling like you have to go into a waiting room and that maybe the chairs aren't sized appropriately. You have to sit there and wait. They bring you in, they put you on the scale, and everybody's the medical assistant, the nurse, everybody's looking at you. The doctor comes in looking at his or her clipboard, and never looks up from the computer type of thing. So it can be quite stigmatizing. And then the first thing they're coming in for, whatever, like they're cold, and then they say, your BMI is elevated. You need to lose weight. And so it can be quite traumatizing to
Yeah.
someone who's been struggling with their weight for a long time. So going virtual with telemedicine in obesity care, I think, of course, there can be some drawbacks. You want to confirm someone's actually the way they say they are. You can do various things to do that. You can have them step on a scale and take pictures and whatever. But assessing maybe where the adiposity or weight is distributed, you can take pictures to get around that too. And just overall assessing people's body language. But like I have found that it takes away some of that the barriers or trauma that people have had before from going into the doctor. And I feel like it is like obesity medicine is made for telemedicine, or telemedicine was made for obesity medicine. And like, especially like think about like during COVID, the pandemic, where people were afraid to go in to
Hmm.
their physician. That's where telemedicine really blew up.
Yeah.
So, what it was like during, I mean, you remember it was just a couple of years ago during the pandemic, people were using telemedicine a lot. And,
Yeah.
people weren't necessarily getting if they didn't have access to telemedicine, they weren't even going to go see the doctor.
Yeah. And we saw, gosh, I saw so many patients during 2020 and even 2021. Just people trying to get their medication refills.
Yeah.
And that's another topic, but I remember kind of being taught and seeing other doctors like not do refills unless the patient was seen in person in the clinic. I don't
Yeah.
know if you had that experience
Yep.
through school, but I remember like now I'm like, why would I want you to be out of your blood pressure medicine?
Yeah.
And so we had a lot of that come through. I think people that were more acutely sick or had a lot of serious chronic issues or were much older and dealing with more end of life stuff, they had a really hard time because telemedicine cannot do everything. But for the majority of like middle aged and younger people who maybe had a couple conditions, like you said, hypothyroidism, blood pressure, diabetes medications, I mean, we blew up just trying to keep people afloat, and managing with lab work as best as we could during the pandemic.
Yeah. So you think about, like, I don't want to go and see the doctor right now unless I like need a physical exam. It can be extremely frustrating
Mm-hmm.
I mean, we still have respiratory, even without COVID, we have the flu, we have RSV, we have all these different viruses. Like, hey, maybe don't want to get exposed to these people that really need to be seeing in person, where you have to do a
Yeah.
physical exam and listen to them. And then you think about people in like rural areas who have to drive an hour or two or whatever to see a specialist of some sort. So, obesity care, you might get a rural family doctor that's trying to take care of a whole town, but specialists can be
Yeah.
extremely hard to get into. You might have to drive a few hours to even see them. And in this case, there's not really a point in doing that because you can do very good care without seeing somebody in person. So, other
Yeah.
people, it might be
Agree.
difficult to travel, other disabilities and whatever else too. And so where it's like we need to remove those barriers. So what's been your transition to like obesity care mostly and doing it virtually? Um, do you feel like it's adequate? Obviously, we do it both
Yeah.
through sequence, but like, what's it like?
Definitely. I think it's more than adequate, to be honest. Most of the patients I'm seeing have tried everything. Rarely do I get a patient that's like, "This is my first time dieting." Like that's really not ever the case.
No, never.
These are usually lifelong or chronic issues that people have. They've tried everything under the sun, supplements, programs, you name it. Um, a lot of Finding an obesity trained physician is, most people, I realized once we got on TikTok this year, didn't know that we exist, and can't blame anybody for that. It's a newer field. Who searches for that when you don't know that it exists? I get it. There's not very many of us, and most obesity doctors have a full blown practice in something else. So it's hard to find an obesity physician, first of all, and then one that actually has the time and the platform in order to do things specifically for weight loss. And doing this through telemedicine, I think it's more comfortable for the patient to begin with. They can, tell us their weight, but they're not getting on a scale with everyone staring at them and feeling insecure about something that,
Mm-hmm.
they have to deal with every day when they get dressed in the morning. Unlike other illnesses, obesity is something that, other people can judge you on and do, and that's unfortunate. But the people that have obesity, they feel that every single day. So sitting behind the computer, I don't necessarily need to do anything specific to evaluate them besides, get their weight, make sure, get their medical history, make sure they don't have any contraindications. And it's more comfortable for them. These medications don't need a lot of monitoring, which is great. And the monitoring that does need to happen, for example, like with contrary blood pressure, people have access to blood pressure cuffs. This is set up really nicely where the patient can be actively involved in a way that's comfortable for them, and we can monitor treatment successfully.
Yeah, the
Um,
the
so yeah, I think
technology is 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 really cool. Like you're able like and then the other thing I think that's really cool is that we have so the technology. So we can't, like you said, time is an issue before. So
mhm.
you know we don't even need to sit down for an hour straight with a patient. We can actually do fewer minutes, but then we have technology to show lessons and we don't have to overload people with an hour appointment anyway. We do
Yeah,
quick little snippets of information, give them what they need throughout the week, and we can monitor at all times during the month. We can monitor weight, side effects, quickly get back. We have, dietitians that can jump in, fitness
Mm-hmm.
programs, and all the little lessons that we want them to learn. It's really cool. I think, the other thing is, people are afraid. They've gone into their doctor to ask for weight loss help before, not just going in for a cold and being told, hey, you need to lose weight, but also they've gone to doctors in the past for help, and they've already done Weight Watchers, whatever other programs, every single program that's out there, calorie counting, keto, fasting, vegan, plant based, whatever.
Yeah.
And the doctor will go, well, have you ever tried, what, fill in the blank, whatever
Yeah.
diet program? Have you ever actually tried this, super exercise program? And it's like, okay, yes, I've tried all of them. Please be helpful. And then, so they're scared to go to the doctor again. So where we can give, you know, like I said, not overload them, making them drink from a fire hydrant, but give them enough information and slowly drip it out through the course of weeks, months, and even, years if need to, with longer term monitoring. That was the other thing. I don't know about you. Did you have people come back every month or every 3 months, or how did you do it for weight
It
loss?
depended on the medication. For things like it's prescribing phentermine in person. That was
Yeah,
one of the more common ones before the GLP-1s became more available. And so I was doing monthly visits for those to monitor side effects. But if somebody couldn't follow up or missed their appointment, or life happens, right? Like
yeah,
it's hard to get to your doctor's office. Not to mention if we're running on time, depending on what the day's like. Uh, so I would have them come back monthly, and then sometimes with the bariatric patients, they would have to see me monthly for so many months in order to be a
yeah,
part of that program. So, but that's hard. It's hard for people to carve that time out of their day.
yeah.
Yeah, it's a lot.
That was a tough. So yeah, I try to get people back monthly as much as possible, but but like you said, like, okay, I have to take pretty much a half day off work each month
Yep.
to come and just have you weigh me and talk to me. Whereas here, you could weigh from your home. You don't have to. And also, if they're having side effects in between, like, after a week, they have to call in. I'm not going to be available. I'm seeing patients, right?
Right. Yep.
The medical assistant leaves a note, hey, can you call this patient back? I have a million other people to call back because of whatever else. I can't just text them back unless we have the little messenger thing, and that's fine. But then there's a million other messages that probably could have all been taken care of with a proactive lesson that went in, and emails and frequently asked questions. And also, good medical assistants or care coordinators that can message them back with other good stuff. And so lots of issues. They shouldn't have to take a half day off work to do that, and they
Yeah.
shouldn't have to wait for a phone call back or whatever. We should make this efficient, and I think that's what we're doing right now. I think it's great.
I I agree. And in order to make it efficient, everybody in the office, virtual or otherwise, needs to be on the same page, needs to be somewhat knowledgeable. The assistants that we have working with our patients, they've been amazing. Where we have pre-made information about different side effects. If they're mild, they can at least
Yeah,
get them some information and troubleshoot a little bit while they're waiting for us. It's so much easier. People are so text savvy these days that for a patient to just say, "Hey, I'm having headaches every day. Is this normal?"
yep,
It's so much easier for them to do that and us to get back to them than to, like you said, take a half day off of work, and come in and see us. It's just not. It's not necessary, in my opinion, to need to be seen in person every time you have an issue on
I
something that's
agree.
chronically being managed.
Yeah, so I think, from a physician standpoint, it's fulfilling. From a patient standpoint,
Hmm.
it's much easier. Nothing against. I think, there's always going to be a place for in-person obesity specialists, but I do think I think you'll mostly go virtual. I don't see a reason why you need to have a huge, expensive facility to make people take half days off work just to be seen. I really don't.
Yeah. And
So
in person, you're limited to a location, of course.
yeah,
And I'm sure there's enough patients in every city where you could easily have an obesity practice. And I think that's great and can be very successful. But, we have state licenses in many states across the country. I don't know. Do you have all 50 or are you, I don't
I
know
have
if you're,
like 28, 26 or
yeah,
28. I think I
I think
let
I
a
have
couple
about 20.
expire.
So I mean,
20.
seeing that there's not a lot of obesity specialists out there, it's nice. We have patients all over the country, and can at least guide them. I think successfully, and like you said, drip out that information when they're ready to meet with a dietitian. We have somebody they can meet with. It's not like that one 30-minute appointment where we're like, okay, you have to eat this and you have to exercise and here's your medication and here's the side effect. Who's going to leave one appointment and take all of that home and do everything? I mean, it's too much to do in one visit. So this is nice. People have, when they're ready, they can, step into different parts of the lifestyle changes.
Yeah, yeah. One of the questions is whether, like, well, if am I seen in person, will I get more results, better results than if I'm online? Honestly, this has been studied a little bit. If you look at it, just behavioral therapy, not medically, they're similar in general for behavioral therapy. There's probably just a slight edge for in person, but it's clinically they're pretty much the same. Now, when it
Yeah.
comes to medicine, I'm overseeing our data, and it looks to be about the same that you'd see in the trials. And honestly, I feel like it has to be better than because of how we continually monitor people and are able to jump in quicker. And like, so say somebody's not responding well, we can jump in quicker because we're monitoring closer.
Yeah.
And you could do that in person too if you have a virtual component to it, but then it just comes back to just a virtual
Yeah.
component. So I personally think it's as good, if not better, at least from a patient experience, just for even addressing side effects. That's what I think, and I do think we can jump in sooner if people aren't responding
Yeah.
to one of the medicines.
And not to
So
mention, if patients feel comfortable and they feel supported and they know that they
yeah,
have somebody there that is willing to help them, because like you said earlier, not every doctor meets this condition with empathy. I think that increases compliance, I don't know how, tenfold or so. I mean, if somebody's comfortable, they're going to want to come back and see you and they're going to want to keep working with you. And then that keeps people on their treatment plans if they're enjoying it. And I know from the experience with my patients through Sequence so far, majority of patients are just very happy. Some of them are they're so happy they're finally seeing results. They don't feel judged. We try really hard, to not bring those stigmas into our visits. And I think that has a lot to do with the success rate as well.
yeah, love to hear it. Well, I think that does it for most of this podcast. Unless there's anything else you want to add in there. I'm a huge fan of this. Obviously, we're both working with Sequence, and if anybody's listening that's not already a part of Sequence, you go to joinsequence.com to see if you're eligible. You take our little quiz to see if you're even eligible for medicine. Then we assess you first to see what medicine, and then see if we can get you one, depending on
Yeah.
insurances and all that stuff. But
I would say don't be nervous about telemedicine. Do your research on different physicians. We're all, those of us here are obesity certified, and it is a real field for those that are just hearing about it. We try our best to rectify poor experiences that you've had in the past. And, we're here to support as much as we can.
perfect. Thank you so much for joining, Dr. Danielle.